That's us. We actually do imaging or x-rays of a patient's body. I mean, if you have broken bones, we are we are the technologists that actually look at your broken bones, but we do more than just broken bones. A lot of people wonder, what else do you guys do? Who are you? What are some professional things that you do? We actually work with patients, third largest medical profession in the world. If you have any questions, I want to hear them. I want to hear I want to hear from you guys about any questions you have about our profession. This is your time to ask because I've got a list of questions that I'm going to be sharing with you all that people have asked on my social media. If you're not following me already, make sure you take a look at a couple of rad techs. We have a podcast that's here on YouTube. We also have social channels, which actually bring awareness to our profession. And this is what I'm here to talk about because I have a lot of fun with the profession. I try to bring relatable content that not only educates you, but it actually brings attention to our field and help people to understand that we do more than take x-rays of broken bones. We actually do nuclear medicine, which when patients have thyroid issues or even cancer, we use radiation, well, not radiation, radioisotopes, excuse me, to introduce into the body so the doctors can follow and find and trace the disease and be able to help you to get a diagnosis and get some treatment for it. We also have radiation therapy, which is usually used when patients have a known cancer and there's radiation directly given to that area. Now, again, we do more than just x-rays of bones. I'm telling y'all, this is a really fun profession. And I want you guys to come to the chat. Let me know what questions you have. But I brought some questions just in case. And we're going to pop some of those questions in here. Now, the next time I'm going to do this differently, I'm going to run it through, and some of those questions are going to pop up on the screen. You'll be able to see, but I want to see your questions in the comments, what questions you have. So, a little bit, I have been doing radiology for 22 years. Yes, 22 years. I do CT, MRI, diagnostic x ray, clinical applications. I've been an instructor for 7 years in the field of radiology and several other things. And now I am hosting a radiology podcast called A Couple of Rad Techs. And my podcast is to bring awareness to the profession, but also not only to patients, but to technologists who don't know what all is out there for them in our field, that you don't have to go to other professions. You can stay right in medical imaging and make good money with your degree, with your profession. And that's what I have guests on my podcast talking about is how they've maneuvered through the profession. If you have children, they're not sure what they want to do. Everybody does not want to be a nurse. Everybody doesn't want to be um, anything else, but most people just know nurses. That's all I knew growing up. Nurses are all in my family. Like I'm just telling you, that's all we knew. But I'm here to explain the field of radiology that is more than just taking pictures of broken bones and pressing buttons. We actually understand the anatomy, physiology, the pathology. We work very closely with our doctors to be able to help patients. So, what are some questions that people have? I just went live on TikTok and I got a barrage of questions. First thing people want to know is, what is a radiologic technologist? Well, again, we are educated medical professionals who take a 2 year to 4 year college program that allows us to be able to study the body and be able to introduce radiation safely into patients for various reasons. We also introduce contrast. We don't just take pictures, we actually inject dyes into patients. And yes, we do them as well ourselves. We don't have to wait on a doctor in many states to do that. I think New York is a state where you do have to wait on the doctor to actually inject the contrast, but we are able to do that. And I've been doing it for 22 years, injecting different types of contrast for CTs and MRIs into patients. Now, you do have to get training. You do have to understand the physiology of a patient and the reasons for doing that. So we are trained, highly trained to do that. You also inject radioisotopes if you're a nuclear medicine technologist. You administer, and we have medical dosimetrists. They actually calculate how much radiation a person is going to get. So if you have brain cancer and they need to give radiation to the brain, my aunt had breast cancer. She got radiation to her breast. You have to diagnose you have to calculate how much dosage over, if this patient has been prescribed radiation for their particular cancer, in order for it to respond to the treatment, the medical dosimetrist, who is in our profession, they have to calculate the amount of radiation over a period of time. So if a patient is getting 16 weeks of radiation treatment, they can't get too much, they can't get too little. It has to be the accurate dosage amount, same area, same place. So these are highly trained professionals, you all, who are giving these dosages and working with doctors to do that. Yeah. Are you guys in the comments? I want to hear from you. I've got comments, questions, but I want to hear from you all. What questions do you have? So that's one of the questions. So you go to school for radiologic technology first. That's one way. The second way is you can choose 4 primary pathways in order to become a medical imaging professional. What are those 4 primary pathways besides the traditional way of going to school to be a radiologic technologist? Number one, you go to school to radiologic technologist. That is the umbrella which allows you to be able to then take maybe just a few months or a year education extra to be able to do any other medical profession in medical imaging. Any other. Door is wide open if you go for radiologic technology. Now, the second option, if you don't want to do that, or that option is not available to you, you can choose either nuclear medicine, radiation therapy, or MRI or ultrasound as a primary pathway into medical imaging. What does that mean? That means if you qualify based on whatever school's qualification is for you to be able to make that your primary pathway and skip radiology technology school, then you can apply to one of those 4 schools and get in and finish your degree under those programs, which they're usually about 1 to 2 years. So that's going to be your other option to getting into the profession of medical imaging or radiology, right? So what would make someone decide one or the other? Well, there's no right or wrong to if you go for radiology or if you go for the other 4. It all depends on, number one, if you choose anything other than radiologic technology, this is what I tell people. If you choose anything other than that, that is what you'll be doing. You will be doing MRI. You will not be able to then say, I want to be a CT technologist. No, you need to go back to school for radiology technology in order to be a CT tech, plus an extra 6 months to a year of schooling for CT technology. That's how that works. So just as long as you know that if you do go to school for radiologic technology, you have all the other options open to you with a short education afterwards. If you choose one of the other primary pathways, that is all you'll be able to do without returning back to school for radiologic technology. So if you're sure that's what you want to do, go for it. There's no right or wrong answer to it. Second question, will healthcare be getting replaced by AI? Ooh, that's a scary, scary thing to think about. Well, I personally, I can't predict the future, but I will say this. You need people to work with people. A computer cannot work with patients. Sorry, just got locked out of my questions. There we go. A computer cannot work with patients. So you have to realize AI has a place. It's been around for a long time. It's nothing new. AI has a place in healthcare. So radiologists use it even now to be able to help them to read actual radiology imaging, to see things a little clearer, maybe what they missed. I'm not a radiologist, so I cannot speak on that, but that is one way that the technology is being used. Can the technology of AI actually work with the patient and put the patient on the table, set up parameters? To a point, it can set up parameters, but you still need that human element, that technologist, to do what we do, which is deal with different varieties of patients. That's one thing I really like to explain, is that as a radiology technologist and medical imaging professional, we just do not sit there and press a button. We may not. I have a nurse friend that told me not long ago, oh, I wish I would have went to school for radiology because you guys don't have to deal with the patients like we do for a long period of time. And I'm like, well, I beg to differ. We may not have a caseload of 10 patients in a 12-hour shift period. You're right, we don't. And have to deal with that patient for those and have to work with those patients for that 12 hours or whatever longer shift is. But what we do have, and I've worked in X-ray, CT, and MRI, and I've done over 30 patients a day in MRI in a 12-hour period, all by myself. No help, no other technologist, no radiologist there, me alone on an antiquated machine. Patients having reactions, patients being claustrophobic, patients needing help to just get on and off the table, into the bathroom, needing blankets, needing to take breaks, get what like we deal with it all. If you guys are watching a replay, let me know in the comments. Is there something I'm missing there? Because I think people don't really understand what we do in medical imaging. We may not have our patients for the length of time that nurses have them, but we don't see any less of patients. We actually, I think, see more patients in a given 12-hour period than the nurses. I don't know any nurse that works with 30. I remember working at a job where I did like 50 CT scans, up to 60 in a day. And that did not include the IVs I had to put in, the contrast reactions, the extravasations that I dealt with. There's the contrast they had to drink and the vomiting that happened and the rectal contrast that I had to do and the spewing out of the rectal contrast. I mean, and these were like 50, 60 patients in a day. Y'all, no bathroom breaks, no lunches, no sitting down. Because in CT, you're like, boom, 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 10 minutes up, boom, 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 go. You're running, still getting people blankets, still getting people comfortable, helping people get undressed. People get dressed, undressed all day long. This is something we do. That doesn't even count the biopsies that we have to do. Sometimes you're on biopsy duty and you're standing up with lead aprons on all day and you're seeing hours worth of biopsies from 6, 7 in the morning, 7, 8 in the morning until 2, 3, 4 o'clock in the afternoon. I'm telling you. I think there's no comparison when people ask, is it harder to be a nurse or a radiology technologist? There's no comparison. I've never been a nurse, so I couldn't tell you. Just like most nurses have never worked in our field, so they couldn't tell you as well. So that is my take on AI. AI will not take over our jobs, in my opinion. We are so valuable, just as most professions are. We just don't take orders and lay people on the table and press a button. There's way more to our profession. So I have a comment here. Thanks, Joe. After going through a radiologic technologist program and getting certified, what's the best work setting to find which will help us with on-the-job training for other imaging fields? Oh, great. Because that's how I got. We didn't have schools like we have today. So that's how I learned CT and MRI. So once you go through the program, I encourage people before you get in the program, make sure to see if the program has an extra to it. Some programs, when you go for radiology, they'll say you can get out with mammography. You can graduate with all your clinicals with CT and MRI. So that's a perk to going to that school. If they're going to guarantee you 2 modalities, graduated with 1. That's a perfect scenario. If not, set up your plan that when you finish school, wherever you go to school, get your ART, get your registry in that first. Then what you want to do, if you choose a job, make it known when you interview at that job. My goal is to do CT or MRI. I'm open to cross-training. I would definitely let them know that in an interview. I am open to cross-training. I'm flexible. Because this is the thing, I went to my career not knowing much about radiology. Honestly, I didn't. And I didn't have anybody I could ask really that really could educate me on it. And first year, I got all my clinicals done. My second year, I chose, because I didn't have any more clinicals to do, I rotated through every modality because I didn't know what I wanted to do. I realized, wow, this is a gold mine. But I didn't want to choose wrong. And if I would have known what I know now, that I didn't have to rush and find, I could have gotten 1 certification there, gotten another one here, gotten another one there. But I'm happy where I'm at with CT, MR, and other things I've done. But I always tell people now, make it known in your interview. And that's what I did. When I was a student, I made it known and made myself available to the other professions and modalities. And I let them know, oh, I would love to do this one day. I would love to sit in here and learn from you guys. I would love to cross train. And I was rewarded with a job at the school I went to in CT. I was also offered an IR job, interventional radiology, right out of school. So it's not going to be a shortage of things. I just knew I didn't want to pull a lot of call. I didn't want to do a lot of call. And I had my eyes set on radiation therapy. That was where my focus was. Instead of realizing to be open to all of the professions that we have available to us. But that's my tip to you is if your school doesn't offer something like that, when you interview, let them know I'm open to cross training. I would actually prefer to cross train. They like that. And if the facility loves that, that's probably somewhere you want to be because they're going to facilitate your growth and it's not going to cost you money where you'll have to go out and pay for your own growth because your facility is not seeing the value in cross training their own loyal staff. Back in the day, there was more cross training, and that's why there was more retention. People didn't really leave their jobs back in the day because they were cross trained. They were that's valuable to people. You're giving me another skill. You're not holding me back from getting another skill because you're scared I'll leave. You train people, they leave. That's what happens. But a lot of times people don't leave. So that's the thing I would say is make it known at the beginning that you want to cross train and figure out through your schooling, rotate through different areas to kind of get a feel for different areas. But that's a great question. Thank you so much, Joe. That's a really good question. If you had to do it again, would you go into MRI? That's one of the questions for my TikTok. Yeah, I would. I would. I'll be honest with you. MRI was not on my radar when I was in school. Like I just said, radiation therapy was my focus. I got turned down twice from there. Never could get into that school. So that wasn't for me, obviously. You're welcome, Joe. You're welcome. Thank you for the question. I wind up going, this is how I got into MRI. They couldn't seem to keep anybody in the department. I was working a CT at a hospital and they could not keep anybody that were working. Nobody would even apply because of the techs that worked there. They weren't the nicest people or welcoming. I'll be honest with you, they weren't. And they ran that department very cliquish. And if you didn't get in there, they made it very hard for you. They gave me 30 days to learn MR. Fortunately, I already knew cross-sectional from CT. So that part I didn't have to learn. But the MRI physics, it was totally different from what I had learned from radiology. 30 days was nowhere near enough. And they didn't have schools back then. So they set me up to fail, but I did not fail. I was there every day for 30 days, learning. I said, if I could at least scan, I might not know what I'm doing, but I could at least scan. So yes, I would do it all again because MRI has opened up. To me, MRI and CT are such a good package deal. When you're registered in both of those things, because they're both cross-sectional, but they're two different. One is radiation, one is radio waves, but they work so well together. I've been able to get jobs to where I scan half the day in CT and turn my chair around and I'm scanning MRI the other half a day. And they're paying me instead of paying two technologists. So I'm making more money. Now, of course, I'm doing two modalities, but I'm compensated for that because I'm registered in two and I can actively scan both. That's where I say to people, be smart about when you choose certifications. Some people go for what's quick and what looks popular on social media, but it doesn't really work well. Like somebody asked me, should they go for ultrasound and MRI? And I ask, why would you go for those two? They don't have any crossover with each other. It's not like you're going to probably work somewhere. I mean, you might, I'm not saying you won't, but I'm just thinking, plan things out right. So that way, if you go to a facility and they say, I really need a CT and an MRI tech, or I really need an X-ray and a CT tech, or I really need an MRI, CT, X-ray tech. I do screening memos as well. I went to school for that. And I was even asked to do screening memos at a place. And they're like, we'll pay you whatever. Like they have so many patients in the backlog of mammography that they were like, name your price. I'm going to tell you, I hadn't done it in so long. I was like, nah, But if I had, I would have, and I would have been doing 3 modalities. I'm not even telling you an untruth. I'm telling you the truth. And that's the beautiful thing of why I tell people have options and have your certifications. I just met with a group of students, and a couple of them said they're students in something else, but they said they knew how to do CT, but they didn't have their registry yet. I'm like, pause right now, go get your registry. If you've been scanning for at least a year in any modality, go get that registry. Go get it. You never want to get comfortable doing something and not have your papers to back you up, because you won't be compensated right for it, and you won't be able to freely go places and work without that certification. If you have your ART certification in a modality that you can scan, you can walk in anywhere and say, I've got CT, MRI, ultrasound, mammography, bone density, anything. You got those papers that show, that you can do it. So I do not regret going to the MRI. I think it was one of the best things that I could have fallen into, because I did not plan to do it. I never did. When I was a student, the MRI department was not very welcoming to students to come in there at all. And they weren't mean. They just did not want us in there. They made every excuse why we couldn't get in there. When I did rotate through there, I wasn't allowed to touch anything. Like, it was not conducive to a student. And I was at a teaching hospital. You would have, but you know, that's why I try to be so forthright and helpful in my content with people, because I know that every place that people work, they're not getting that. And what does it hurt telling somebody how they can further their life and do better and not have to go down a harder road than what I went through when I was in the learning? I kind of blindly got into it. I didn't really know. I knew a couple people that did radiology, but I didn't really know, no. And I think some people don't know what to share, even if I don't think the people that I knew what to share. They didn't know what I would want to do. What I don't think they purposely didn't share that these are all the things. I just don't think they knew themselves. So this is why I create the content that I do and have a podcast, a couple of Rad Tech's podcasts, because I want people to see the conversations I'm having with people on my podcast who are in the profession, not for 2-3 years, but long periods of time. I've been in it for 22 years, and I feel like I got another 20 something to go. And I don't want to be scanning that long. I feel like for me, this profession also has opened up the experience that I've gotten, opened up for me to be able to do what I'm doing and talk about it. So my podcast allows me a way to be able to do that. So that's creating another way for me to do have conversations about the profession and create a job for myself within medical imaging, where I still can be in medical imaging. And check the podcast out, because I do talk about and talk to different type of professionals in our field, where they can share how they got in, how they navigated the field, and how they're staying in it. So hopefully that's helpful. Thank you for those questions. Okay, so another question that I have in my TikTok. So this is what someone said. This is a good one. I'm in MRI school, and a lot of what we're learning we won't use in the field. Why is that? And why don't they teach us only what we will need? And why don't they teach us only what we'll need? Okay, so that's a good question. I was an instructor for 7 years, and we have a curriculum that we have to follow in order to meet the JRCRT and the ART guidelines. If we deviate from that, we could lose accreditation, which means there won't be any schools out there for y'all to go to. And it creates a consistent learning environment to where you get into a program and they say they're going to teach you this, and they teach you that. Technology is moving so fast that some things that you learn in school depends on what machine you're working on. If I work on Siemens, and I go to a school that only has Siemens, hospital that has Siemens machines, when I go over to this GE, it's going to say something totally different. Same concept, but it's going to be different than how I learned. Everything you're learning in MRI school, you will use in the field. I don't really know how to explain that, but the air is getting really dry. Sorry, you guys. But everything you're learning, you made one thing about MRI school, the light bulb never goes off for MRI until 3 to 5 years later. One day you're scanning and it goes, oh, that makes sense. Case space makes sense. Wow. Reconstruction. Oh, is that why I did a half Fourier? Like, oh, is that the phase frequency? Oh, that's why I changed that. Oh my good. I mean, things will just suddenly make sense now once you're scanning for a few years. And I can say that till I'm blue in the face and people are like, that's not, no. A few years later, I see them out in the field. Um, Students give you a hard time as your instructor. Be nicer to your instructors because they have to teach a curriculum, you guys. And just because you don't understand what they're teaching doesn't mean they're teaching bad, poorly. I love to say that because I always pity my teachers because trying to teach a group of people is very hard. And also people that won't study. You do not come to class to gather all the information. Your job is to study at home. Once you study at home, you come to class to kind of put it all together. And then once you get into the clinical side of it, it starts to come together more and more. That's why you're in school for 6 months to a year. That's why you're training for 90 days at a job. It takes time for things to come together. So I think for me in life, your perspective has to change. You can't say that what you're learning in school is not going to be what you're going to use in the field. You don't even work in the field. So how do you know what you're learning in school is not being taught in the field? Because you don't work in the field. The people that are teaching you, they already have their license. They've already been in the profession out there working in the field. They know what happens in the field. Case in point, student came in, they're scanning spines on MRI. Oh, they can scan spines. They think they're just the best thing since sliced bread. Then they get a spine with a stimulator in it and all kind of hardware all in the back. Well, that press the button and regular spine stuff that you've been doing. Now you got to think. You have to think through it now because now you have to incorporate shortening that scan because with this particular stimulator, you can only scan for 15 minutes total. But the scan sequence, the protocol is a 20-minute scan. So how are you going to shave 5 minutes off without degrading the image quality, without scanning the patient over the recommended amount of time that the manufacturer is saying? How? If you don't learn the principles of what you feel is not being taught to you or is being taught to you, but you choose to block it out because it doesn't make sense to you because you don't work in the field, you're not going to be able to think that through. Because everything they're teaching you, the principles in school, you will, and it's just not for MRI, it's for every modality, you will have to use at some point in your profession. You will have to use. So that's what I say to that. Just really take in what you're learning at school and you'll be surprised. You'll be very surprised. So last question, if I don't have one in the comments from those that are on live, thank you guys for joining me live. I appreciate it. This is my first live on YouTube in a long time. I will be doing more of these. But the other question is, where did it go? Let's see. What's a LMRT? So that's a limited medical radiologic technologist. They're not in every state. It's not a program that's offered everywhere. I've never seen that before until I started working around like Texas and a couple other places. It's someone that has gone to school to learn limited radiation safety and limited radiology. They're not a registered radiologic technologist, so they cannot use the credentials of a registered radiologic technologist by the ARRT. They are given a test that is monitored or given by the ART, but they're not ARRT credentialed, or their tests are not given by the ARRT. That's just like if you go somewhere and you take a test because they're hosting or proctoring the test. But That doesn't mean that's who gave you your test. That's not who wrote your test. That's not the governing board of your test. So the ART does not run the LMRT program. That's specific colleges that do that. But you get your license as a limited medical radiology technologist, which means you can work legally in a chiropractor's office, a doctor's office, things like that, but not in a hospital. They do have bridge programs. So I liken it to people that go to school for CNA, LPN, like an LPN. LPN can take a bridge program that gives them the ability to sit for the NCLEX. They take their own NCLEX, but it's not the NCLEX for registered nurses. Two different tests. Hence, they cannot do what registered nurses can do. Same with LMRTs. They cannot do what RTRs can do by the ART. We can work in hospitals, we can administer contracts, we can go on to higher levels of the profession. They cannot. Again, they do not work in hospitals as well, and they cannot use the ART credentials of RTR. Their credentials are LMRT. So hopefully that answers the question. But as to should you do it or not, it's totally up to you. There are plenty of people that do it. And my thing is, be honest with yourself and say, if I do this LMRT program, will I stick with it and see it through to do the bridge program into RTR as a registered radiologic technologist? Will I commit to it and do it? If you will, go for it. If you know you're not going to, don't put a speed bump in your plans or a stop sign in your plans. Just go ahead for the 2-year program for radiology technology. That's what I say. I feel very privileged to do what I do as a profession. I've enjoyed it for 22 years and it served me and my family well. And I hope you guys got so much out of this podcast. I thank you all for joining me live. Anyone that's watching the replay, and this is going to be more often. So I'll do more premieres so you'll know that I'm coming up and you can plan your questions. Thank you, Joe, for leaving a question in the comment. And those of you that are watching the replay, leave your comments as well. And I will definitely come back and answer them. Otherwise, thank you all very much. Please check out my podcast, A Couple of Rad Techs podcast, and check me out on my socials down in the description. You can find me at A Couple of Rad Techs. Toodles. Thank you.